Hi everyone, welcome back to your channel. I love pharmacology, and in this session, let us learn about a very important one-line answers that will be useful for your MCQ exams also. So, which let us start with the first uh, example. So, which route has got 100% bioavailability? The route which has got 100% bioavailability will be your intravenous route. Intravenous Intravenous route has got the 100% bioavailability. So next is the microdosing study. So microdosing study refers to it is a phase 0 clinical trial. Please remember, it is the phase 0 clinical trial. So what does the area under the curve denotes in the log dose response curve? So area under the curve denotes the extent of drug absorption. Please remember, it represents the extent of drug extent of drug absorption. So what about the Cmax? Cmax will tell you about the peak concentration, peak concentration that is reached. What about the Tmax? Tmax will tell you about the rate of drug absorption. Please remember, it tells you about the rate of drug absorption, whereas the area under the curve will represent the extent of drug absorption, whereas the Tmax will represent the rate of drug absorption. So coming to the bioavailability, what does bioavailability mean? So bioavailability means it is the fraction of drug, that will be reaching the systemic circulation, systemic circulation following the administration, in an unchanged form, So this is the definition of the bioavailability. So coming to the next line, there is cycloplegic choice in case of children haze. So always in children, cycloplegic agent of choice will be your atropine. Because the children has got high ciliary tone. So which is the shortest acting mydriatic? So the shortest acting mydriatic will be your tropicamide. So this is the shortest acting mydriatic. So which is the drug of choice for anaphylaxis? Anaphylaxis, the drug of choice will be your adrenaline. So please remember, the drug of choice will be your adrenaline. So what about the physiological antagonist of histamine? Physiological antagonist of histamine will be your, again, the adrenaline. So which will be the physiological antagonist of insulin? It is your glucagon. So which is the drug of choice for motion sickness? So it is your scopolamine. Which is also called as hyoscine. So which is the drug of choice for malignant hyperthermia? So malignant hyperthermia, the drug of choice will be your dantrolene sodium. So what is cevimelone? Cevimelone is a M3 agonist. Basically, they are used in the treatment of Sjogren's syndrome. So if there is a poison due to acidic drug, so what you want to do for urine, so that the acidic drug will be excreted. So urine should be alkalinized. So how do you do the urinary alkalinization? With the help of the sodium bicarbonate. For the basic drug poisoning to remove from the urine, you need to acidify the urine. So how it will be done? With the help of ammonium chloride. So what does the steep dose response curve will represent? It represents the narrow therapeutic index. So if there is a steep dose response curve, that means the drug has got the narrow therapeutic index. That means it is less safer in nature. So which is the sympatholytic agent which is associated with the first dose effects? So please remember, it is with the alpha blocker, especially it is with the prozosine. So which is the drug of choice for pheochromocytoma? The drug of choice will be your phenoxybenzamin. Phenoxybenzamin. So phenoxybenzamin is a alpha blocker. Alpha blocker. So whenever you give a drug for a pheochromocytoma, so initially you give a alpha blocker, followed by you administer the beta blocker. So which drug has got anterograde ejaculation as a side effect? So it is the alpha blockers. It is the alpha blockers, especially the prazosin, and the phentolamine. So vasomotor reversal of Dale is seen when you give a adrenaline. When you give a adrenaline, so there will be increase in blood pressure due to the alpha 1 and decrease in blood pressure due to the beta 2 activity. So beta blocker, which is responsible for the uh, nitric oxide release, will be your celiprolol as well as nebivolol. So which is the drug of choice for beta blocker overdose? It is your glucagon. So which is the drug of choice in case of OP compound poisoning? So the drug of choice will be your atropine. So please remember, the drug of choice will be your atropine. So what will be the drug of choice for atropine overdose? So it will be your physiostigmine. So which is the drug of choice for chronic gout? It is your allopurinol. So if allopurinol is having any side effects, you can go with the febuxostat. So what is the mechanism of action of allopurinol? It will going to inhibit the xanthine oxidase inhibitor. So which is the enzyme reactivator that is useful for reactivation of the acetylcholine in case of OP compound poisoning? It is your oximes. It is your oximes. So oximes. So example is pralodoxime, obidoxime, etc. So what is mirabagrone? Mirabagrone is a the beta 3 agonist. Basically, they are used in the treatment of overactive bladder. So what are the drugs which are used for smoking cessation? One, you can use varenicline, which is most effective. It is the most effective one. And you have bupropion, which is an antidepressant, and you have a nicotine. So most cardio selective beta blocker is your nebivolol. So longest acting beta blocker is nadolol, and the shortest acting beta blocker is esmolol. So what is the mechanism of action of iosine? Iosine is a M3 receptor antagonist. Basically, they are used where in case of motion sickness. So xylitol is a 5-lipoxygenase inhibitor, mainly used in the treatment of the bronchial asthma. So etoricoxib is a selective COX-2 inhibitor. So sodium chromoglycate is basically a mast cell stabilizer. Basically, it is also used as a part of the anti-asthmatic treatment. Most common side effect of the beta 2 agonist is your tremors. So next, coming to the enzyme inducers. So examples for enzyme inducers are, first is the glycofulvin. You have phenytoin, you have rifampicin, you have smoking, then you have carbamazepine. Then next is the phenobarbital, and also even the chronic alcohol intake can induce the enzyme. So which are all the drug which comes under enzyme inhibitors? You have mnemonic, that is vitamin K cannot cause enzyme inhibition. V stands for V stands for valproate. Valproate. You can write it as verapamil. You have K for ketoconazole, C for cimetidine, one more C for ciprofloxacin, and E stands for erythromycin, and I stands for INH, isoniazid. So next, coming to the side effects of the anti-epileptic drugs. So please remember, sodium valproate is associated with the gum hyperplasia. This is also associated with megaloblastic anemia, and also it is causes Hayden-Toyne syndrome, which is really characterized by three things. One is the cleft lip, second one is the hypoplastic phalanx, and third one is your microcephaly. Sorry, this is the side effects for phenytoin. So all whatever we told, it is the side effects for phenytoin. So then what will be the side effects for sodium valproate? Sodium valproate will cause alopecia as the side effect. It can cause liver damage, hepatotoxicity, and it can cause neural tube defect. And among these anti-epileptic drug, it has got most teratogenic drug. Even the carbamazepine can lead to teratogenicity, etc. So what about the topiramate? Topiramate will also cause renal stones, as well as it causes weight loss. So even the felbamate can cause renal stones and the weight loss. So vigabatrin is associated with the visual disturbances. What about the drug which is preferred for treating cardiogenic shock associated with oliguric renal failure? It is your dopamine. So please remember, it is the dopamine which is preferred in the treatment of the cardiogenic shock, which will going to retain the renal blood flow to the renal blood flow. So which is the drug of choice for Alzheimer's? It is your donepezil. Donepezil is the drug of choice for Alzheimer's disease. So what is the drug of choice for Parkinsonian? In case of Parkinsonism, the drug of choice will be your levodopa. Levodopa is the drug of choice. So apart from that, you should also remember that which is the antidote for benzodiazepine overdose. The answer will be your flumazanil. So which is the antidote for paracetamol poisoning? Antidote for paracetamol will be your N-acetylcysteine. So which is the toxic metabolite which is associated? It is your N-acetyl para-amino benzoquinine amine. So it is NAPQI, para-amino benzoquinine amine, N-acetyl para-amino benzoquinine amine. So which drug causes race syndrome if it is administered in children below 12 years? It is your aspirin. Which will going to cause the race syndrome. So which is the drug of choice for the rheumatoid arthritis? Which will be the drug of choice? So the drug of choice will be your methotrexate. So this was some of the important one-liners that you can expect from the topics like general pharmacology and from the autocoids, uh, and from the CNS as well as the ANS chapters. So if you find this video useful, please do subscribe to my channel. I love pharmacology, and do not forget to share this video with your colleagues, and please click the bell icon for more updates on pharmacology. Thank you.